So I'm just going to ask you a series of medical questions. I'm going to be jotting down the answers in my notepad, and I may be asking some follow-up questions and presenting some equipment to try and jog your memory if you are a little bit uncertain about some of the questions that I ask. Okay, so diving straight in with the questions, there are going to be a broad range of medical questions. First up, have you ever had a test performed on you, either at the hospital or the opticians, called ocular coherence tomography? Okay, and from what you remember, was you ever shown the scans of what the back of the eye looked like? Okay, if I could just show you this scan here I have. This is what the result may have looked like, that your medical professional should have shown you, with the layers of the retina, and the Bruch's membrane here, and the underlying choroid, with the dip at the macular section. Do you ever recall seeing anything like this at your appointment? Okay, that's not a problem. Okay, thinking about your health, what was your last blood pressure reading? Okay, so the blood pressure sounds stable there. Do you take any medication for your blood pressure, such as ramipril, amlodipine, for example? No, that's excellent. Okay, and for the next question, have you ever seen an ophthalmoscope before? Yeah, excellent. Okay. Did the ophthalmoscope make good sounds? Very good sounds. Okay. Did you find that the light was too bright, too intense, or was your optometrist considerate? You sound like you have a very good optometrist there. Okay. And did the ophthalmoscope sound a little bit like this, as the consultant altered the focusing wheel? Okay, good. Did they change filters? Good. And did you hear the metal sound on the handle here? Excellent. And did you know that the battery is housed in the base here? Excellent, so we don't need to spend too much time there. Just thinking about the light filters that were on offer. Okay, did you see the white light? Did you see the green light filter there, the red for it? Cobalt blue? And how about the yellow light? Did your optometrist or ophthalmologist use these filters? Excellent news. Okay. Next up, have you ever worn contact lenses? Hard or soft lenses? Okay. Daily, 2 weekly, monthly lenses, or were they extended wear? Excellent. So if they were reusable, it is likely you would have seen the contact lens case or been in possession of one. It's very important to replace these cases every so often. But were you aware of the sounds the contact lens case made? Did you use fresh solution each time when using the lenses after storage? Good. Do not top up the solution. Excellent. So did you have a contact lens case such as this? Brilliant. Okay, so we're going to diverge a little bit to matters more of the mind now. So for a question here, have you ever seen a psychiatrist before? Okay, how long ago did you see the psychiatrist? Okay, and following consultation and then visit to your doctor, were you prescribed any medication for your anxiety? Do you remember the name of the medication? Okay, if you're unsure, let me show you what the medication box may have looked like. Was it amitriptyline that you were prescribed? The braille on the front here. Was it a 10 milligram box such as this? Okay, not sure. That's fine. That's fine. Excellent. So, next up, when was your first known experience of ASMR, autonomous sensory meridian response? You know, that kind of tingling at the back of the head, back of the neck? Good. Okay, and if you're currently watching and listening to ASMR, who are your favourite artists? Maria, excellent choice. Dr. Tinglebottom, fantastic, one of my favourites too. He's very technical and he gets very close to the microphone and he's got an untouchable voice. Any other artists? SRP, heard a little bit about him. Apparently he's an optometrist who is fairly new to the game, but he's not doing too badly, so I will check his videos out after today, I think, since you've mentioned that. Okay, and so what are the 3 things that you do to relax the mind, body and soul? Hot bath at the end of the day. Excellent choice. And meditation. Okay, good. Excellent. And last one. Okay, that's fine. Now, has your optometrist ever performed a stereopsis test on you? It could have been where you pop the glasses on and you had to grab the fly's wings or find the butterflies. Okay, let me jog your memory with this stereopsis test. So that was the butterfly, and with the glasses you had to locate another butterfly in the area here. Do you remember seeing anything like this? Okay. Anything like this. And what about trying to find Pac-Man in the squares here and telling the practitioner which way he was pointing, whether it was up, down, left or right. Is it coming back to you? Did you perform this test? Okay. Not to worry. Right, okay. Has your optometrist or ophthalmologist ever performed a cover test on you? If so, have you ever seen an occluder? This is a new green occluder I recently acquired. So your medical professional would cover one eye and check the binocular status of the eyes, particularly looking for a squint or strabismus, looking for euphoria, and then they may have swung the cover from left to right, left to right. You've definitely seen an occluder. Good. Do you recall what colour the occluder may have been? White. Excellent recollections there. Excellent. Okay. Right, moving on. Have you ever seen a wall chart price list such as this before? Now this is going back in time where the prices were as such. Do you recall ever seeing one of these charts with the data there? Any recollections? Okay. So I'm noticing on your previous medical records it says you did wear glasses, but you haven't got any on today. Have you ever worn bifocals? I'll just demonstrate what I'm referring to. This is an uncut bifocal lens here with a plano prescription in the distance here. And then the eye looks down into the reading zone. When you wish to read, close up, maybe 30 to 50 centimetres, something like that. And the bifocal, it may have a flat top, curved top, but essentially this is the reading zone. Have you ever worn bifocal lenses to help with your distance and reading simultaneously? Okay. Did you successfully adapt to wearing bifocals? Was you okay with managing steps? Okay. And here is an example of bifocals in a frame there. This one has a curved top here instead of a flat D-seg type. Did your bifocals look something like this in your lenses? This is a plastic frame without pads and metal sides here and plastic tips there, plastic tips. Does it ring a bell for you? Okay. Have you ever had any surgery to any area of the body? Have you ever had any ocular surgery? So you've just had a foreign body removed from the cornea. And when was this? Which hospital did you attend? Were you a day case or did you have to stay over? Do you remember what drops you were prescribed afterwards when the foreign body was removed? Did you have to visit the hospital again the following day? Okay, and imagine this is the eye that you had the foreign body in. Do you recall being told whether it was in the superior portion of the cornea? Was it in either the nasal or temporal zones here? Or was it the inferior zone? Or unfortunately would it have been in the central corneal zone? So, superior, inferior, or the nasal, temporal, nasal, or is it the central zone? Do you recall being told where the foreign body was lodged? Excellent. Just going back to the ophthalmoscopy side of things, were you ever shown a specific diagram, such as this, labelled as to how the actual machine functioned on a technical level? That's fine. I wouldn't expect everybody to have seen one of those. Excellent. Okay. Just going back to when you saw your psychiatrist, did they ever show you any such images? Or anything similar? Or maybe dissimilar? Anything such as this, did you say? Okay, that's fine. Okay, now just thinking back to when you last saw your general practitioner. Yes, I know, it's virtually impossible these days, isn't it? Well, I don't know what's going on in their minds. Okay, yeah, so when you saw your general practitioner, did they use a stethoscope? It may have looked like this. The medical professional may have done this. Okay, and now they may have applied the top there to the chest, asked you to have breathed normally, and they would have listened to your heart rate, heart rhythms, listening for any abnormalities as the sound travelled to the practitioner's ear. Do you remember having this test performed? That's fine, that's fine. See if I can locate my grading scale. Here we go. Okay, so there is a condition that can affect the eyelids where they become red, inflamed, scaly, uncomfortable, painful, dischargy eyes. Have you ever suffered from Blepharitis? Have you ever experienced Blepharitis? Possibly. Was the condition diagnosed? How long ago was this? Okay, and do you recall, I'm using the grading scale here, do you recall your eyelids when you potentially had blepharitis looking as severe as this, with the redness, the capping, discharge scales? Where would you say your eyes ranked on the grading scale for blepharitis? This is now blepharitis. This is a trace amount leading all the way to severe. Just have a little look. Okay, so what about the opposite eye, your left eye? Where would that have ranked on the blepharitis scale? Looking at the blepharitis scale. Excellent recollections there. And how did you manage your blepharitis? How did you treat it? Did this impact your contact lens wearing? Did it have an adverse reaction or effect on that? Okay, good. It seems as though you followed the correct protocols there. Okay, so our time is almost up. Just looking for one last piece of equipment. Has your ophthalmologist or optometrist ever checked the pressures of your eyes, which is called tonometry? Okay. Was it with the puff of air test, or did something physically touch your eyes? Something touched. Do you recall having any eye drops instilled into your eyes before the pressure test was performed? No drops. Okay, and it wasn't the puff of air test. Okay, and when was this test performed? 1 year, 2 years, 3 years ago? Okay, so that just leads me to think that the test performed would have been the eye care tonometry test. Okay, let's show you the machine to see if it jogs your memory. Something like this. Something like this on the inside of the case. Potentially. Okay. And did the machine look something like this? Yes, so it is ringing a bell. Was there an adjustable headrest? Did the professional read the values from this little display here? Excellent. And did the optometrist press this button to obtain the readings? Excellent. Did the machine beep? Well remembered. And when the optometrist placed the fresh probe inside of the machine, were they housed in a case like this? Was it a case like this? Excellent. So that was in fact the last question. I will collate all the results, the questions, and I will keep them in your file in case you ever need to refer back to them. And yes, I'll keep all the results for when you next come for your next set of medical questions, whenever that may be. Feel free to recommend or suggest any questions that you'd like to be asked next time. You're free to go. I will see you when I see you.